common problem that we see in physical therapy is a torn meniscus. To understand how to heal a torn meniscus, one of the important things is to first understand what it is. The meniscus is cartilage, and cartilage, you have cartilage in your ears, cartilage in your nose, cartilage in most joints. The purpose of cartilage is to protect the joint. A joint is where two bones come together. So for example, have you ever eaten chicken? Like a chicken drumstick or a chicken wing? Well, on the end of the bone, okay, there's that rubbery, grizzly material that becomes a little chewy if you get a piece of it. When you take a bite, that is cartilage. And a chicken leg, which the drumstick looks something like this. This is the ankle joint in the chicken. This is the muscle. And then at this end, you'll have a grizzly part where you have that white grizzly material. That's the cartilage for the chicken's knee, okay? In the human knee, you have the thigh bone or the femur. You have the tibia or the shin bone, and then on the outside, so if we were looking at somebody's right knee from the front, there would be another bone right here called the fibula, and the kneecaps rest right here. The cartilage sits in this space in between, and what it does is as we're walking, running, jumping, doing stairs, doing the things that we do every day, that cartilage, that meniscus, protects the bone. When you get bone on bone, it's painful. One of the interesting things is that you can have meniscus damage and not feel any pain at all. You don't feel pain until you actually get bone on bone, or begin to get bone on bone, and the wear and tear that comes with that. That is extremely painful. And most people will note on the inside of their knee, right here, they begin to feel pain. That's usually one of the first steps in leading up to a total knee replacement, or the Synvisc injections. And that point is right here. What we want to do when we see somebody with a knee problem or a meniscus problem, we want to strengthen the muscles that surround and control the joint so that they don't continue to get the general wear and tear. What we're looking for is that a stronger muscle will decrease the forces through the knee joint. Most importantly, there's the quadricep muscle in the front of your leg. There's an important muscle right here on the inside of the knee called the VMO. The VMO is called the key to the knee. That's VMO. And the VMO stands for vastus medialis oblique. On our website, on our YouTube channel, we have the top 3 exercises for knee pain. And the first 2, which are called a quad set and a straight leg raise, both focus on this muscle right here. There are also a host of other exercises that focus on that same exact thing. A person with a stronger VMO decreases the forces through their knee joint and the forces through their meniscus. Sometimes that can heal. That's a long, complicated process where basically the outer third of the meniscus can heal, the inner 2/3 generally does not heal. Also, age has something to do with that. Also, weight, also the person's health. If a person is healthy and they strengthen the VMO as much as possible and address any other problems that may be surrounding that at the hip, at the foot, at the ankle, or the lower back that are contributing to the increased force here, generally that person can heal and can go about doing the day-to-day activities they want to do and that they love to do without pain. And that's how physical therapists help with the torn meniscus.